everyone. Thank you for coming to this bright and early one, security one this morning. I'm going to talk this morning a little bit about IT security and risk management practices, generally speaking for healthcare, but kind of specifically on the ePatient side. And this was based on the talk I did last year and just a lot of the information we learned about the kinds of information that are being generated, the new platforms, hardware, and everything. And so what we want to, as a security person, I think, okay, it's great that we're generating all this data. There's tremendous health benefits, but then I think there's a lot of data. And so the security person in me wants to figure out the best way to secure all that information. Just a little bit of background on me, and I'll skate through this, but I'm Vice President, Managing Consultant of an IT security firm based down near Santa Barbara. We focus primarily on healthcare. I run the division. I've conducted 25 HIPAA and healthcare IT security assessments for hospitals, or just 25 for hospitals alone, plus several assessments for casinos, banks, Ivy League, and public universities. And as a company, we've performed around 125 security assessments just for hospitals alone, and probably just that many more for business associates. So first of all, I want to start with everybody, I think, has seen the breach that happened a few weeks ago from the CHS, 4.5 million records hacked by the Chinese. And I don't think, talking to a lot of people, even those in healthcare, a lot of them don't really understand the value of that information. They think sort of the knee-jerk reaction is, it's my radiology results. What value does that have to somebody in China? The reality is that an electronic medical record is actually the highest value target on the black market in terms of a single record. A credit card number or social is about $10, and the medical record goes for about $50, typically, per record. Partly it contains your name, email address, physical address, date of birth, socials, family names, medical insurance account numbers, and that's actually the big reason. What a lot of people don't realize about healthcare data theft is the big reason it's such a high value target is only the identity theft part of it is only a small portion of it. The big part is actually medical insurance fraud and prescription fraud, because they tend to they have access to all of your account numbers, contract group numbers on both prescription, dental, and medical, and it's very easy to because it's such a fragmented system in healthcare, it's very easy to actually commit fraudulent acts. So on top of that, then what we're getting into now with all these devices are what I like to call BYOP, bring your own PHI. Last year we talked a little bit about BYOD, bring your own device for the providers and kind of their best practices. But now we're seeing between the number of devices that Samsung, Microsoft, LG, Motorola, and others are developing, plus the actual platforms they're sitting on top of, Apple's HealthKit, mHealth on Microsoft, Google's on initiatives. You've got multiple layers of analytics and storage for all this information. So in terms of the kind of information that people are now starting to generate on their own, it's the same as what's in that medical record, plus because it is your mobile device, you've got login and password info and account information on essentially every account you have, social media, banking sites, anything, you name it. Plus the actual stored data themselves on the devices, because hardware theft, like on the healthcare side, laptop and mobile device theft is actually still the #1 cause for healthcare breach. There are fewer incidents of the type what we saw with CHS, and that we see 3 and 4 million records. The vast majority of actual breaches themselves are related to a stolen laptop, or it's somebody walking into a hospital or a clinic and dumpster diving and stealing paper records. So in terms of just kind of a little bit of background on how this is actually getting much worse. You would like to say that it gets worse before it gets better, but it's just not getting better, period. So this time last year, or all of last year, 199 reported breaches, 7 million plus records. Just to date, as of, I think I pulled this data as of August 30th, 214 breaches and nearly 7 million records already, and we've still got 4 months to go in the year. 42% increase in breaches, 38% increase in records versus this time last year. And this doesn't include anything that is stolen from a person's own personal device. And we're already starting to see that there's a lot of anecdotal evidence about that, but not a lot of hard evidence just yet. So we break this down in terms of the identity risk points, and then in a minute, the data integrity risk points. So what we look here is what we call social media to social engineering. And for those who aren't familiar with the term social engineering, social engineering is basically conning somebody into giving up information that they normally would not give up. On the the electronic side, that typically comes about as email phishing scams, pretext calls, and then there's a lot of variations in between. And then social engineering can also consist of somebody just walking into a facility and, the catch me if you can type thing. If you act like you belong there, people will treat you like you do and not question you. And so you see a lot of breaches that way, where people going in and actually literally picking up computers, walking out with them, or picking up boxes of records and doing the same. So when you look at the kind of information that's out there, and this is how a person can, from a malicious standpoint, how they can start to build a profile of you. So between, say, let's take Facebook alone. Date of birth, hometown, current residence, family names, relationships, phone numbers, high school, college education, graduation dates, who you work for now, and then geolocation, so tagging you're checking in somewhere. On the, related to that are the targeted ads. I mean, if you go to Amazon, search for a pair of Chacos you really like, next time you go back to Facebook, odds are pretty good you're going to get presented with an ad for Chacos. Next would be, say, something like LinkedIn, where you can pull work history and dates, past and current residence. And again, this is almost like corroborating information to what you can find in these additional sources. And then besides that, we have what we'd call technical flaws, which are things like cross-site scripting and SQL injections. And this is basically a true technical hack against the mobile apps or the web applications themselves, that somebody could actually go in and essentially hijack and intercept the data itself. In terms of the data risk points, there's multiple areas here. So you've got your PHI, you've got financial general account data once a device is stolen, and that's just, say, your smartphone. And you've got wearables between everything from the Fitbit on up to the new, like the Galaxy Gear series, to the new, or the rumored iWatch from Apple and others that are going to have a tremendous amount of diagnostic capabilities. Again, mentioned interception, hijacking of this mobile device to app data flow. So whatever, you have the device itself and the platform, the data that's going to any app that you have on there that you may purchase through the app store or that may be native to the device. Then you have something which is what we'd call, in security, we call it CIA, which is it's the three tenets of security: confidentiality, integrity, and availability. So the next one, in terms of inaccurate biometric data from consumer devices, this really goes into the integrity point of view, in that when you have devices like, again, I keep going back to Samsung, but they are a very large hardware maker. They're making a device now, for example, that has a sensor on the bottom that will read not just your pulse and blood pressure, but also pulse ox, and start to gather additional information about you. And then the app itself allows you to input diagnostic information from your provider and from other sources. So again, you're talking about multiple layers of analytics there. How do you know what Samsung is, the hardware is detecting, is right? Or how do you know what the app itself is right? And even just a fraction of a % of an error in a calculation on some of this can be devastating to a person's health, if, particularly in the case of, say, prescriptions, or, if they're going through some kind of regimen. And then you have mapping conversion errors, which we're starting to see, which are all this data that is being generated by consumers, and and it's going to probably explode tenfold within about the next 7-8 months. They're bringing that to their doctor or to their provider, or to the hospital, and they're basically saying, here's my information. And so at that point, you've got all this consumer level data, hardware, applications, and you're trying to move that into an $8 million piece of software that hospitals are using to run their medical record system. And even then, go to 3 different hospitals, they're going to be using 3 different EMRs, and even then, if they're using the same EMR, they're going to be on 3 different versions, depending on where they are in the meaningful use attestation. So what you have to look at is this way, is that, MRI and clinical medical devices, again, the thing that takes up a room this size, those are just as vulnerable to attacks as, as anything else. And so you've got to consider that, so are your phones. the axiom is nothing is sacred in terms of the ease to hack. This is, pardon the pun, kind of not entirely apples to oranges, but this is right here on the left. This is a screenshot from Apple of what HealthKit, when they supposedly will announce next week or sometime soon. This is the kind of information it's going to store, and this is going to be sort of native and embedded into iOS 8. So diagnostics, your fitness records, lab results, medications, your sleep patterns, vitals, everything. On the other side, this is the end-user license agreement from the Google Play Store for Facebook Messenger. So what you have to look at it as, first of all, that's Android and this is Apple. The licensing agreements are the same on both sides. So you're going to have this on your phone, but any app you install you're going to have to agree to this. It's going to have full access to your identity, your contacts, your location, your text, your phone. It can make calls and receive calls without you knowing. It'll have complete access to your photos, media, files, the camera. It can tap the camera and microphone without you having to give permission to do it, even when the phone is off. Your Wi-Fi connection information, if I'm here at Stanford, it'll actually pull that information and see that I'm here, and it can deliver ads based on that. And then it can look at, again, the entire device ID and call information, which that would be things like the actual serial number or IMEI number of your device. So what you have to keep in mind here is your PHI is going to be part of this. Facebook will be able to mine your PHI just as much as they mine your browsing history on Amazon right now. So when you start to look at the fragmentation we're starting to see occur and how it's going to be getting, it's kind of increasingly ramping up. So Apple's partnered with Epic, major EMR system, and the Mayo Clinic for the HealthKit platform, basically just to sort of try to establish some kind of secure end-to-end analytics process and a platform for any new apps to be built on. Google's partnered with Novartis to develop smart contacts lenses, and it actually will measure glucose levels through the contact lens. And Amazon, oddly enough, has actually held confidential meetings with the FDA lately. So as we all see, anything that Microsoft, Google, and Apple do from a hardware and app standpoint, Amazon ultimately falls behind, or they're not too far behind. So I found a great quote here. It says, the downside for doctors is that they're opening themselves up to potentially enormous amounts of data they would have to sit through and access for accuracy. And so this kind of starts to speak to the idea of not just sort of the integrity of the data, which is a big part of it, but you're now starting to put a burden on the physician and on the provider themselves. And last year there was a lot of talk at this conference about sort of this worldwide database, or this need for a worldwide database of genomic sequence. And people would say they're going to upload their genomic sequence, it'll be anonymous, they'll match it up against what's out there, and it'll kind of, to a certain degree, eliminate the physician. And I completely disagree with that on many levels, but this is a great point here. This researcher in Israel was able to take anonymous genomic data and narrow it down to a 4-person family in Tel Aviv. So there is no anonymity, and even if you think it is, every region in the country, or every country, every state, county, city has unique cultural and ethnic backgrounds that makes it very easy to trace, even things that are coming in from the mitochondrial DNA side 4 and 5 generations back. They're still showing up, and you can identify populations very quick. And so what we're starting to get into is, are we all business associates? So in terms of the high-tech rule, if you look at the italicized portion here, it says vendors that offer the personal health record directly to the individual and not on behalf of the covered entity will not be considered business associates. But there's still a lot of fuzzy area right there. Are we liable? Who is liable if there's a PHI breach involving a cloud vendor, like say an AWS or the app developer? Whether it's one of the big names like Apple or somebody like that, but if it's anybody that's selling a $10 app on the store, if there's a breach, what happens? Who is liable? And do patients themselves become liable over that breach data outside of the business associates themselves? And I think a good example would be if you're sharing all this information with your hospital and your provider, and your phone and the hospital have the same set of information, but you lose your phone and that data is breached. the hospital is going to do everything they can to say, no, it doesn't matter if you shared it with us, you are liable for this, not us. So strict, to the letter of the law right now, the hospital is on the hook for that, but they're catching it very quick. So, what we look at in terms of trying to map over, what our company does is we do these, security risk analysis projects for large hospitals, health systems, universities. When you look at, and so what you want to do is you want to start mapping over some of these same principles to the consumer level. What can you do to protect yourself? So the basics of a HIPAA or healthcare analysis would be a gap analysis against policies and controls, internal technical vulnerability assessment, external vulnerability assessment, which is penetration testing, the remote and physical social engineering testing, like I mentioned earlier, wireless security, Wi-Fi infrastructure, and we'll tap a Wi-Fi or an access point at a hospital and see if even if it's secured, can we trace that back to any PHI that may be publicly available on their network? And then web application security testing. So when you try to map this over on the consumer side, I think there's just some good basics that ePatients and just any consumers need to follow. And because my point of view is that I think there's way too many benefits for the actual creation and management of this data by consumers themselves. It creates sort of a daily log and sort of information stream on their health patterns as opposed to a snapshot or a diagnostic snapshot whenever they go to a hospital or go to see their provider. So it's just a matter of protecting it correctly. I'm sorry. That's my timer. I'm out of time. I apologize, Android and all that. So anyway, I'll go through this quick, different passwords with 8-character complexity, change it every 30 days, especially if you see a breach event involving your hospital or health system. Don't store any PHI and USB drives and portable media. Typically, it's unencrypted and are easily lost and stolen. On the network side, enable all your router, firewall, web filtering configurations. Always set your laptop for full disk encryption. On the Mac side, it's called File Vault. Keep your antivirus up to date. On the social engineering side, assume anything you provide online is going to be retained. You can't assume it won't be used or won't be repurposed somehow. And then, so it's kind of a matter of everything is you also want to, on the hospital side with your providers, you want to do the same thing with them is question everything about their security as well, because if you're doing what you can to protect your data, you need to ask them the same questions. So ask them if they've gone through any kind of security assessment process. Since a lot of the meaningful use stage 2 requirements are going over to a requirement to build and provide a patient portal online for patients to access their information, ask them, have they verified security controls with that? Because there are a lot of very poorly implemented and patient portals are kind of off-the-shelf type products out there, and they don't have very good security. Does the hospital themselves have any history of breaches? Depending on the state, by state level, they may have to auto-notify for that, or they can try to keep that as close to the best as possible. And then ask them, this information I'm giving you, what are you going to do with it? And it's just a simple question, but it's a valid question. Are they going to just do a straight data dump into something? Are they going to analyze it and interpret that data? Ask the question. And then on the device and Apple side, like I showed with Facebook, take that end user license agreement at face value, because your PHI will be reused. And like I said, it's not just that Facebook will use that information. At that point, you're talking about development resources on the app side, application side that are potentially offshore as well, and you start to get into a lot of actual federal issues on FERPA and other side as well in terms of sort of trying to prevent offshore resources from having access to critical information about U.S. citizens. And then compare your data with anything that you generate, compare it to what the hospital says you have or the provider says you have. Again, that's just a straight accuracy type check. So again, this is just a quick thing here about business associates and high tech, and just kind of covering a little bit of what all is covered there. I'm going to skip through that because it's blah, blah, blah. This is reference, and this is reference on stage 1, stage 2, just saying that hospitals have to go through risk assessment process. And again, my point is that you as a consumer, if you're generating as much data as they are, you need to do the same yourself. That's all I have. Are there any, I have a few minutes here. What questions can I answer? Yes?
Can we have a copy of your presentation?
Yes, absolutely. Yeah. And actually, I had to pare it down from about 5 or 6 other slides. I had one that said anonymity is a unicorn, which is it's this mythical, magical thing that we think exists, but it really doesn't. Yes, there you go. But it really, when you look at it, look at the iCloud breach earlier this week. That was a simple hack. They got their security questions. All I need are 2 sources, essentially Facebook and LinkedIn, and maybe sometimes one other to get your family history, all their names, all that information. And then if I wanted to reset your password, the security questions are mother's maiden name and hometown, or your best friend growing up. You can find that information in 3 minutes on any social media site, even if you're not connected to that person.